What I find in the transplant patients is they're extremely resilient. They will continue to do things even though we have put them through a lot. In their life, we put them through high-dose chemotherapy, they have graft-versus-host disease, they may have side effects, and yet they continue to persevere, they continue to smile, laugh, and continue to try to live their life. And I think that's a lesson we should learn from everybody.
Working with the transplant patients is just a wonderful experience. I find that these oncology patients have gone through so much in their lives, and they are just display so much courage and diligence and perseverance, and every time they come in, I learn something from each one of them. It is just a privilege to work with them and to meet them where they're at, to hear their life story if they're wanting to tell us, and to just encourage them to just that this is going to work for them, and just to go on with the process.
Transplant patients have it. They're fighters. They want to stay alive. They want to do everything they possibly can. They're looking for us for that guidance and how to help them through the process, how to make them tolerate and cope. They're listening to our every words, and they want to know that we care. And that's definitely, I try to purvey, as I'm talking to patients, and that I do care. It's not about a person, a number. It's who they are. It's what they're going through, and it's not just them. It's their family members. It's their children. It's their grandchildren. It's those things that they're looking forward to: weddings, birthdays, all that good stuff. And it's important to keep those things in mind as it's not just about the treatments. It's about the patients.
I think that the biggest asset for transplant nursing is just the care and compassion that we provide for patients. We do a lot of education. I personally do a lot of education over on the stem cell unit with patients and families. I also teach the discharge class. So I think it's very important for patients to have nurses with a lot of knowledge, because I feel like that the more that you know what to expect, the more comfortable you're going to feel going through transplant.
When I first see somebody, I like to get to know who they are, what their personality is. So you're answering all the questions that they have, but humor is my biggest thing, and people make that comment all the time of, oh, I know that laugh, because I'm always laughing and joking with my patients. I think that's the best thing to do to make them forget about something, what's going on for a little while.
You have the community of patients, and you get to see them, and you get to see them go through the whole process, and you build relations with them, friendships and things along the way, and you see them have their ups and downs, and you kind of see that, and you experience some of those things with them. In the ICU, ER, a lot of times, a lot of people just come in and go. There's no personal relationship there at all. Sometimes that's good, sometimes that's bad, but that's what's nice here in the transplant is it is nice to have those relations, and you get to see people as they go through their ups and downs, and there's a lot of good things and there's a few bad things, but that's what builds the community sense of everybody.
I just think of all the patients that we have helped over the years, how much hope we give in people, how much courage it's taken those patients, to be part of this, how much knowledge it's taken from the doctors and all the staff, and how far we've come and all the advances that we've made. And so I just think it's just a very wonderful thing for this institution.
To do 5,000 transplants, it may not seem like a lot, but it's huge. It's huge, and it's a big deal. And I think that what that does in a facility is it makes you better. So the more you do, you tend to get better at it. You tend to refine your practices so that you can actually take care of the patients better.
I think 5,000 says a lot about us. It says a lot about Siteman Cancer Center. It says a lot about the care that we give, the research that we do, and it says a lot about other areas of the country trusting in us, saying, we want you to go to the best place there is. We want you to get the best care you possibly can. 5,000 says people trust us.